We're back with our sleep disorder segment, and we're talking to sleep expert Dr. Avi Ashaya, and we're taking your questions from Twitter. Rebecca Green asks Dr. Ashaya, how can I be evaluated for sleep apnea and what steps should I take? That's a good question.
That's a great question. The way to be tested, as I mentioned before, would be to do a sleep test. The nice thing about our National Home Sleep Apnea Program is that you could be tested at the home and literally be done very easily with just a phone call or looking us up on the website. The website is sleep.avisha.com, which is A-V-I-I, two I's, S-H-A.com, and the phone number is 877-4-AVISHA, which is for A-V-I-I-S-H-A. This would be a very low cost, very reliable way for you to be tested for sleep apnea in the comfort of your own home.
Well, that's great information. Next up is Brian86. This is such a good question. If I snore, does that mean I have sleep apnea?
Great question. Everybody asks that question when they come and see me, and of course the big reason is that most of the time it's either the wife or the husband brings the other and says, hey, he or she snores too loudly and now we're sleeping in different rooms. That's usually a bad sign, and that usually means that you do have sleep apnea. What we do say to most patients is when you do snore so loudly that your bed partner has to move to a different room, that usually suggests that you have sleep apnea. Or if the snores are so loud that they wake the bed partner up. Most of us will snore at one point in our lives because we've had too many drinks or we're very congested. But when you snore regularly and it is fairly loud and what we call heroic, it usually suggests that you should probably be evaluated.
Heroic snore, really?
Yeah, heroic, which is really loud, like a hero.
Okay, good stuff. Jess J. Sometimes I fall asleep for an hour or two and then can't fall back to sleep. Are there any in-home remedies or treatments available to me to help me fall back asleep? That's a good question.
Yeah, there are certainly many home remedies. What we usually recommend to most patients who have difficulty with either falling asleep or staying asleep is to develop a regimen, much like with our children when they're young, develop a regimen before sleep. So taking it slow, playing a crossword puzzle, some hot milk, but most importantly there are home remedies. There are many over-the-counter remedies, things like valerian root and melatonin, and many different types of combination therapy which you can get in many of the health food stores and even in our offices as far as being able to get enough sleep at night. These are non-addicting and you can take on a regular basis as opposed to, unfortunately, many of the prescription medications that we offer that you become dependent on.
Good stuff. So follow routine, including counting sheep. That's got to be one of them. Luke Harden, if I have trouble falling asleep at night after a long day at work, what can I do to make my house and bedroom more conducive to sleep? That's another good question.
A good question. Dr. Kennedy, you touched on that a little bit, which is making the bedroom a safe zone, if you will. So a dark bedroom, white noise is actually really good, which you can also buy very easily either on the internet or some of the stores where it makes noises like water or rain that helps dampen out the outside noise. Having a very comfortable bed, and most importantly, you have to look at your bed partner. Many times your bed partner may snore, and that alone may make it very difficult for you to stay asleep. Pets who may snore or jump onto your bed, neighbors who are very loud, and you have to look at your medications and medical history, because the idea behind getting a good night's sleep is to make sure everything that potentially can affect sleep is controlled.
So great advice. Make your bedroom a place to sleep. Ingrid 87, I find myself extremely exhausted around 2 o'clock almost every day, but then once it comes time to go to sleep, I can't. Are there any suggestions?
Well, that's a very tough question because you actually have to look at your sleep schedule and see exactly what it is that you're doing. Most of us will, as Dr. Kennedy, you alluded, require about 8 hours of sleep, one way or another, give or take about an hour. And what happens is if we don't get that amount of hours of sleep, then we find ourselves sleepy. So if for some reason you are sleeping only 5 hours per night for whatever reason, then you will need to take a nap during the day. And alternatively, if you're unable to fall asleep because you're staying up late watching movies, then of course you'll find yourself sleepy. What we do know is that we actually have 2 time zones where we are very sleepy. The biggest one, of course, is at night when most of us sleep, but if you look at the Europeans and even the Middle Easterns, they commonly would take an afternoon nap. So it's not uncommon for all of us to feel a little sleepy around 2 o'clock, and we would if we could, and all of us should probably take a small little nap at that time.
So the kindergarten nap is something that we should be continuing to do in our everyday life. Next up is Pat Kelly. I've been taking Benadryl to help me sleep for a few weeks now. Is it possible to get addicted?
Yeah, Benadryl is an antihistamine, and it is also sedating, as we all know. So it does help with sleep. And unfortunately, what does happen with Benadryl, much like any other sedatives, if you will, is that you do get addicted. So your body will get used to taking a pill on a nightly basis, and when you just try to stop, it makes it very difficult. You almost have what we call rebound insomnia, where not only do you go back to how it was before you took the Benadryl, but it's actually even more extreme, and you have even more difficulty sleeping, and you instead will take more and more Benadryl, or you will seek other alternatives such as prescriptive medications from doctors to help you fall asleep.
Wow. So that is some incredible information. I want to thank you so much, Dr. Avi Yeshaya, sleep expert, for joining us here today. And please, if you missed anything from today's show, make sure you visit emPOWERme.tv, MD-VOD, because he talked all about sleep, why we don't get enough of it, sleep apnea, how to diagnose it and treat it. That was outstanding information. Thank you so much, and please join us next time on MD-VOD.